Myself. Okay, we're unmuted. Hi, everyone. We're very excited. It's a little chaotic, and we're working on in the field today. But welcome. I think we'll get started in just like 1 minute. Very exciting day today. We have lots to talk about, and we will actually be reporting and doing our media session from the SPOC campus, where they've set up tents. They've had these tents for many months now, and they're doing vaccinations. You can see behind me Rick Lembo and Dr. Schultz and Alex Clifton, and we will actually be having them join us on our media session today to talk about the great work that they're doing, not only with vaccinations, but other very innovative projects that they're helping the community with. So stay tuned, and I'm going to mute myself again, and we will start in about 30 seconds, I think. Sorry, just 1 more minute. Sim just needs 1 more minute. Thank you. Hi, Joe. Thanks for joining.
Hey, Dr. Vora. I tell you what, Dr. Vora, you're always at the fun spots. You are always at the coolest places, I tell you.
Colleague, you've been doing some field visits too.
Yeah, I get to go to Kerman after this, so I'm excited about visiting Kerman later.
Oh, perfect. Okay, great. Well, we'll definitely talk about that. We're going to get started in just a minute. Talk is just like, you know, just getting their vaccines all around us. So it's really exciting.
Good day.
And Sim will just let us know whenever he's ready. All right, we will go ahead and get started. Thank you all for your patience and your flexibility. We promise this will be a really unusual and very unique session. Welcome to our media presentation for May 13th. My name is Ray Svora. I'm the Interim Health Officer for Fresno County Department of Public Health. We'll go ahead and start with our just basic statistics and then discuss vaccine updates and then have a very nice featured presentation about SPOC and the wonderful work that they're doing with the vaccinations. We're actually on site. That's why I'm actually outdoors today in their vaccination tent. And we will actually show everyone around the wonderful facility that they've been able to set up here to get our community vaccinated. In terms of total cases, we're now at 101,838. So we do keep adding several dozen cases every time. The total number of fatalities is 1,688. And currently we still have 91 individuals that are hospitalized with COVID-19 across area hospitals. Lots more information about just our COVID-19 testing results and statistics. I think one thing that we are also keeping better track of, not complete, but still better track of, is the variant situation. And that's really in partnership with the state. We're really relying on the state to do this testing called whole genomic sequencing to figure out whether we have variants of concern circulating in our community. Currently, the number of variants is 517. Just to give you a breakdown, approximately 300 of those are the California variants, and 93 of them are the UK variant. The remainder are South African and Brazilian variants, which comprise about 16 out of those 517 cases. We will be meeting internally with our department and also working together with the state to try to really expand our ability to track these variants and do the best that we can to try to get a more complete picture about exactly how many there are, whether people are ending up in the hospital as a result of these variants. And then obviously these variants are actually being described all the time. So if any other variants of concern are encountered in our county, we will definitely announce that to the general public and to our media partners. We have lots to talk about in terms of vaccines. Let me just turn it over to Joe and see exactly what's going on at the county level. And then maybe whenever you're done with your remarks, Joe, we can actually walk everyone around our site here at the Sierra Pacific Orthopedics campus.
Awesome. Thank you, Dr. Bora, for inviting me to come speak today. Good morning, everyone. And so let's get you caught up with the amount of doses administered in Fresno County. That's 674,000 doses administered to Fresno County residents. And so the distribution system, as of Monday night, we were at 715,000. What we saw in the system this past week were about 4,000 doses a week. And so it's a little bit of a stabilization of 4,000 doses per week. But, you know, that's better than just a complete decline of doses there. So, yeah, and so it was second doses were due this past week. And so I think that's what kind of attributed to that stabilization of those doses per day. So that was really good to kind of see that in the data this past week with the doses. Big news, 12 to 15 is eligible with the Pfizer vaccine. And so all of our county clinics, we've notified everyone. The state has approved it as well. So 12 or 15-year-olds can get vaccinated at any clinic in Fresno County. Our partners are aware of that. My Turn has been updated as of this morning to allow the 12 to 15-year-olds also to register on My Turn. So you shouldn't have an issue there. And there's a lot of Pfizer in the community, so that is the only vaccine that is approved for 12 to 17. So that is good news that we have a lot of clinics with Pfizer out in our community. So definitely get that get vaccinated, get out there. Also, we are only ordering about 1,500 doses for next week. The system is, and the reason being that we just have a lot of storage in our refrigerators and our freezers throughout the entire system. So we want to be mindful of the vaccine, and we're working with all of our partners in Fresno County to really move those doses around to whoever needs them, and really doing that to support the system as a whole. So a minimal order we're making next week, but we are just really managing those doses the best we can within the system overall. You know, you've seen a lot of the events happening, a lot of the incentives are coming out, and I really want to thank all of our partners. You know, we didn't give our partners a lot of time to get ready, and so many people were willing to do it and really work with a very tight timeline. And so you're seeing the zoo today and tomorrow, the Fresno Grizzlies games. You're seeing those vaccine clinics. Centro La Familia is doing a clinic with incentives in the downtown area, one of our low vaccine uptake areas conferences as well. So you're just going to see a consistent flow of events and just some innovation areas that we're working with. And we're working with some local mobile food vendors as well. And so more to come with that as we kind of roll those out there. So Dr. Moore, I think that's my update for the group today.
Thank you, Joe. And, you know, I'm going to give you the opportunity to share the really good news about teenagers and adolescents. So do you want to just speak a little bit about the Pfizer announcement?
Oh, yes, I did. Did it not come through earlier, Dr. Vora?
Yeah, I just wanted to make sure everybody was aware that, you know, we were definitely aware of the FDA announcement, and then we were just waiting for the CDC and the CDPH to also go ahead and flip the switch. Unfortunately, all of those agencies have their own timelines, so all of those switches have been flipped, and as of this afternoon, we are going to officially approve the use of the Pfizer product for teenagers as low as 12 years old, which I think is a wonderful development. The other thing that just came across my email is that, you know, teenagers sometimes need other vaccinations at the same time, like, for example, for meningitis, et cetera, HPV. And it turns out that they can actually get those vaccines near or at the same time as these vaccines. So that's a question that comes up quite a lot, actually, on the adult side, is, you know, if somebody needs a vaccine either before or after the COVID vaccine, how long should the waiting period be? And typically that advice has been 14 days. You don't want to do the COVID vaccine, you know, 14 days before or after another vaccine. And actually the CDC's scientific committee said that, at least in the case of teenagers, that it's okay to go ahead and do other vaccines at around the same time. And I think that that's a really good, convenient way for families to not have to come back for a second appointment, that they can actually get a bunch of vaccines at the same time if that's what they need to do, just depending on where they are in their vaccine schedule. So we'll look for that. We know some of our local providers have already gone ahead as soon as the FDA made their emergency use authorization announcement earlier this week. And so we know that some teenagers have already started to get their vaccines, which is wonderful. But as of today, you're going to start to see a lot more public service announcements. You're going to see our website changing, and we're going to be putting out advisories to our medical community as well as to the general public that the age for the Pfizer product has been lowered down to 12 years and older. Let me pause there and see if there's any questions for Joe or myself about our vaccine rollout. I'll just note that I'm very jealous because I heard Ohio is going to have a really great incentive. They're actually sponsoring like a lottery, and I really wish California would do this, where if you get your vaccine, you're actually put in to go win like a big pot just as a lottery system. And I think that that's really a great incentive. I think that that's going to work really well. And that's really the innovative thinking that we need to be doing to get people to get their vaccines. I don't know if Gene's on, but maybe we can talk to him about doing a county lottery.
Yeah, I'll
go ahead with questions, folks, if you have any.
Hey, Joe, I know I've asked you this a couple of times the last couple of weeks. It's Jocelyn, but just with the Johnson & Johnson vaccines, I noticed with the clinics this weekend, it's going to be Johnson & Johnson. Do you still have a lot of them in your freezers, and are they getting close to that expiration date?
Yeah, there is. The Johnson & Johnson in the Fresno County system, towards the end of May, we're still sitting on a considerable amount of Johnson & Johnson that expires the end of May. And so, you know, last week I reported about 1,000. We were able to go through about maybe 200 of those doses this past week. But that is concerning to us. And then there's another allotment of Johnson & Johnson that we still have had from our initial orders there right before the pause. And so those are going to expire towards the end of June. And so we were successful in getting Johnson & Johnson at our rural sites over at Kingsburg. If you look at their clinic, they're operating with Pfizer and Johnson & Johnson. And we are doing that with our pop-up mobile clinics. You're going to see some of those clinics really testing out managing Pfizer and Johnson & Johnson just to see, address the community needs, but also just to insert Johnson & Johnson into the lane a little bit more. But that definitely is concerning when we have a significant amount of Johnson & Johnson that just isn't moving as fast as it used to.
Just to be clear, the clinics this weekend, like the Grizzlies and Centro La Familia, that's just Johnson & Johnson, though.
Correct.
Let me just add, I think there's a little bit of misinformation about Johnson & Johnson, and I'd like to have the opportunity to clear that up. As you remember, they did have a pause just to investigate a very rare consequence that seems to be related to Johnson & Johnson. But that pause has been lifted, and this vaccine has gotten the full seal of approval from the CDC and from other scientific committees that have looked at it. You really have to weigh the risk of getting COVID and landing in the hospital with this extraordinarily rare risk that is associated with Johnson & Johnson. And I think that when you do that risk-benefit ratio, it really weighs in favor of going ahead and getting that vaccine. Whether it's Johnson & Johnson or another vaccine, they're all really good products. But I just think that for whatever reason, the public perception is that the Johnson & Johnson is somehow inferior or definitely going to cause problems, and that's not at all true. For the vast majority of people, they have nothing to worry about with the Johnson & Johnson product, and they can go ahead and get this vaccine with very little risk to themselves. And at the same time, they'll be protected from COVID, which really does cause a lot of problems, as everybody knows. And so you really have to take that into account, is that, this is still just a great product. It's been scrutinized more than even the other vaccines. And if it wasn't, safe for general use, then the CDC and the FDA would definitely have put more of a warning, but they really didn't. They looked at the cases and they were totally comfortable with allowing it to be used in the same way for the same populations as all of the other vaccines. And it's a one-shot vaccine, which makes it super convenient. You don't have to come back for a second appointment. It actually makes our vaccination clinics much more efficient and more available to a lot of our communities. So I just want to put in a plug for what a great product it still is, despite the pause. Obviously, the pause did put a roadblock or a little bit of a speed bump in our ability to get the Johnson & Johnson distributed. But now that that's behind us, this really needs to be embraced as something that is another really great tool in our toolbox to get our community protected against COVID. Let's go ahead and switch gears a little bit if Sim and the team are ready. I think we'll have, is Rick here? Okay, great. So Rick Lembo from Sierra Pacific Orthopedics team is going to walk us around the vaccine clinic that they've set up. And I think Sim is on his phone so that they're going to be able to be mobile. And I'll just let Rick narrate exactly where they are and exactly how the process works. And go ahead and unmute yourself and take it away, Rick.
Dr. Warren, thank you. Jeremy's with us today too. We're going to come out so there's no interference. Jeremy's with us today too, so he'll talk about how this all started and his operation, because it's your party.
So we're running at a lower capacity this week because we're doing second doses only for the last few weeks from when we were doing the first. So I think we're only have about 200 to 220 a day. Prior to this, we were doing about 7 to 1,000 a day. So we've actually reduced our footprint by about 50%. This is our parking lot at our spine center over on Spruce and Sharon, where it was employee parking and overflow patient parking. But in January, when we needed to roll out a larger operation, we cordoned it off and repurposed it to our mass vaccination drive-through. All the cars are entering off of Spruce Street, where we have a long kind of snaked out and delineated route for them. Prior to our reduction in capacity, we had an eligibility checkpoint at the entrance where we were initially checking age groups and employment statuses and determining whether or not they were eligible and what dose they'd be eligible for. And then as they worked their way around, we were running 2 lanes and we would meet them over here for their registration process. The registration tent, which we've since removed because of reduced capacity, had 8 computer stations where we were fully staffed to do registration in our practice management system and our EHR. We would register them and collect their insurance information, place the paperwork on their windshield, and then they would be free to move around back to the injection tent.
So when they got to injection tent, we had teams, we had vaccination teams of at 3. We had a runner, a writer, and a vaccinator. And that was the ability to get the card written, separate any paperwork that needed by vaccinator for data entry later, and then administer the vaccine. So at a time, we would have fully staffed. This was 22 full-time employees all the way start to finish, not to include Jeremy and I. As they finished through the vaccine tent here, they would exit to the left. We had luxury bathrooms in the corner, and then here in front of American Ambulance is the observation area. So the 15-minute observation that was mandatory, American Ambulance was stationed in case of an anaphylactic reaction or anything. We have one staff member that would walk up and down and monitor the cars. Also, what Jeremy put in place was while you were in observation, there was a QR code based clipboard that while you were there, you would schedule your second appointment right from here while you're in observation. That QR code would be scanned by their phone, taken right to Prep Mod, and then right to their appointment in their 21 or 28-day interval. After the 15 minutes, they would exit back out onto Spruce. In total, a sweet spot was 75 cars in the parking lot, and we could do roughly 125 to 150 cars per hour. Our goal, and where we got lucky with some of this and just the volume that we did, was the average number of vaccines per car. When we were doing healthcare professionals, teachers specifically, you typically were 1.5 vaccinations per car. But general public, tiered eligibility, 75 and up, 65 and up, you'd have 2.5 or almost 3 people per 3 vaccines per car. It would take you 50 minutes to go through, to move one car through the lot. 50 minutes, you can either vaccinate 3 people or you can vaccinate 1. So that's how we were able to efficiently get some of those numbers as high as we did.
So back in the beginning when we were really busy, it was interesting because if you look over here, you can see cedar across this grass field. This field is empty. They were going to build some skilled nursing units there and then stop. But in the beginning, we would judge our line by looking across the field at north and at southbound Cedar, where the cars would have snaked down Spruce, up Cedar, and then around Alluvial. We've seen that. We've seen cars there again a couple weeks ago when we initially opened up to the under 65s. But now there's not that much interest. But it was a cool thing to see that the lot with 75 still cars in there. About 50 more cars would get into Cedar. And then in the morning, we would screen all the way up to Cedar and Alluvial prior to opening and check just to make sure everybody was eligible.
Yeah, and you guys became kind of legendary because you did this so early in our mass vaccination efforts. I know you even got some national coverage. And you had people driving in from other cities to come find you because they weren't able to get vaccines in their own jurisdictions. So
our second day.
Yeah, what was the furthest away that somebody drove to come find you for the vaccine?
I mean, I know we saw people from Southern California. Our second day when it went public, and we hadn't even made it public, it just through word of mouth. Our second day, we had about 8 city blocks gridlocked at 7:15 a.m. Our line came up Spruce, Cedar to Alluvial back to Millbrook, but then it went Millbrook back to the Herndon frontage street. So our Herndon campus, IQ, the I Institute, St. Agnes Foundation, C-Care, this entire 6-block area was completely gridlocked at 7 a.m. on one day. And we had staff just running up and down town, trying to let people know that they weren't necessarily in the correct line. It was some growing pains, but it was what it took. I think it's the price we paid to be able to open up so early and do mass vaccinations in such a small physical footprint.
It was 4 months today. So we were approved as a provider to vaccinate healthcare providers on the 29th of December, and our staff was completely vaccinated. Those that elected to have it on the 30th and the 31st of December. We then continued with healthcare providers only, and the very first day of the drive-through was 4 months ago, exactly to the date, January the 13th, and that was for healthcare providers only. We had to push the pause in the morning because messaging from the county was that they were going to open up to 75 and up, and that's what happened that one day. So we originally were healthcare providers, and then it went right to 75 and up that day. and the onslaught ensued.
Yeah, great. Wow, well, thank you both so much. We know that you're wrapping up and tomorrow is your last day. Are these second shots? I mean, are people able to drive in today to come find you, or are you guys just wrapping up your shots?
They are. We're vaccinating till about 12:30 today, and the same thing from 9 to 12 tomorrow. We're offering the second dose of the Pfizer only.
Okay.
We are seeing some people that are coming that are looking for a second dose that received their first somewhere else. We have the inventory for that, so we're okay. So if you don't have an appointment, you can still come. We have about 180 appointment slots filled for tomorrow, so we expect somewhere between 2 and 250 with non-appointments. But we have the vaccine.
Great to hear. So if you need your second dose of Pfizer, then come out to Spock. They're happy to serve, and they have a very efficient machine. Lots of folks on the ground helping, and just a wonderful facility here right on their parking lot. And I just wanted to commemorate just you know, your creativity, your enthusiasm, your flexibility with really all of the aspects of this pandemic. And I don't know if you guys are able to come into the tent, but you know, at Public Health, we know COVID isn't over, but we feel like it is time for us to really step up and thank our partners. And so we're actually bringing back something that Dr. Bird had been doing, which is this award called the Pillar of Public Health Award. So we know that you've been pillars of the community's health for many decades. And right now, we just wanted to say thank you so much on behalf of Public Health. We really couldn't be doing this vaccination program without you. This pillar of public health is really just commemorated in this plaque. And let me just read for the media partners what it says, just so that they understand how significant this is. This says it's a Pillar of Public Health Award given to Jeremy and Rick, Rick Lembo and Jeremy Elin, and the entire Sierra Pacific Orthopedics team. And we're actually going to meet a couple more of their team members in a little bit with just a whole other innovative program that they've done. And that's why I was so excited to be able to present this, is because I think Spock has really risen to the occasion time and time again through the many months of COVID-19. Early on, they actually developed a screening app for the smartphone called Vera Health, which was just far ahead of its time in terms of being able to screen people that might be at higher risk of COVID. Later on, they helped us tremendously with testing, not only here at their campus, but really with mobile testing. And more recently, as you can see, they've been very intimately involved with the vaccination process here in the county. For all of those and so many other advisories and guidelines and so much education and outreach that they've been able to do, we just wanted to commemorate their contribution and give them this Pillar of Public Health Award. So it's my honor and pleasure to be able to present this to Rick and Jeremy, who are right behind me. So thank you so much, guys. Thanks, Dr. Bora. Yeah, sure. Sorry, we couldn't have done this with a more in-person ceremony, but I just wanted to say thank you so much. We really value your partnership, and we look forward to continuing the collaboration, if not with vaccinations, which we know are wrapping up, then certainly with other things related to COVID and the health of the community. So thank you so much. On behalf of Public Health, we're really excited to be able to offer this award to Rick, Jeremy, and the rest of this Sierra Pacific Orthopedics team. Thank you.
Thank you
very much, guys.
You can shake hands.
Yeah.
Well vaccinated, we can shake hands.
Shake hands. We don't need masks outdoors anymore, which is great. So, you know, there is progress. We're making progress here in the county, and we couldn't have done it without you. So thank you so much.
And thank you, Dr. Bora. We know that as much as you've been doing, it's not all you've been doing right at the ER and the real job. So everything that you've done for the community and for the county and for Fresno and for the state for that matter, I wanted to thank you on
guys.
behalf of Spock.
Thank you guys so much. We're all one team. As Joe likes to say, we are all one team. So whenever we're able to give our teammates an award like this, it really warms our hearts. So thank you so much.
No, thank you. It was a pleasure doing it, and it's a little emotional when it's going to be all over after all the effort.
Right. I know. I was just thinking that myself, is that I know that we're not through it totally, but we're definitely, you know, every day brings better news. And so someday we'll sit back and tell each other stories about this pandemic and the surreal time that we've had in the healthcare system. In the meantime, we just got to push and get people vaccinated. So thank you for helping us do that for
Thanks a lot
many
again.
thousands of doses that you've done. How many total doses did you guys do?
We're over 45,000.
45,000 doses delivered by a little old orthopedics outfit in North Fresno. But they continue to innovate and they continue to create new solutions for the general health of the community. And that's why they've definitely earned this Pillar of Public Health Award. So thank you, Jeremy. Thank you, Rick. If it's okay, thank you guys. If it's okay, I'll just go ahead and introduce our featured presenters, because we're not done with all of the great things that Sierra Pacific Orthopedics actually offers. It's my great pleasure to introduce Dr. Michelle Schultz and Alex Clifton, who are joining us also from the tent. And they're actually going to be talking about a very innovative program called Medically Supervised Weight Loss, or Lean MD, which is offered at Sierra Pacific Orthopedics Clinic. Thank you so much for taking time out of your busy schedule, ladies. Please tell us about this program and why it's so vital for our community, and what Sierra Pacific Orthopedics can offer to our community.
As Dr. Bora was saying, I'm an orthopedic surgeon here at Sierra Pacific Orthopedics, and what I have found is, just in my orthopedic practice, over the past few years, we've been seeing a bigger and bigger problem with obesity with our patients, leading to joint issues, leading to increased risk with surgical procedures, and it's becoming more of an issue. We've really seen that come to light with COVID and the high increased risks of severe disease with the obese patient population. So it is really a critical issue that is presented to us right now, not just in Fresno, but all over. So that is what piqued my interest in this area and got me going and looking at what can we offer these patients, rather than just saying you need to lose some weight, but is there something more that we can do to help them in that way? And that's when I was introduced to the Lean MD program. And this program is a medically supervised weight loss program that was developed by physicians in Northern California. And I touched base with them, found out about the program, and brought it into the Sierra Pacific Orthopedic practice a couple of years ago. We've been seeing growth of that program and success with our patients over the past couple of years, and it's really starting to grow even more right now. I think it's really important because with obesity, it's a problem that people can actually control. And especially in this time with COVID and people feeling like they're really out of control, this is something you can actually do something about. And it's a significant medical problem that, again, you've got control over. You can actually do something that can change this, that can help you, that can really lead to improvement in your health overall. So I think it's a really important factor. And this is just really an opportunity for patients and for people to get this piece of their life under control. The program, I'll let Alex talk a little bit more about the program, but it's been great, and we've been having our patients involved in it, like I said, for the past couple of years with recent significant growth.
Yeah, so to continue from what Dr. Schultz was saying a little bit about, and some major highlights of the program, this is all real food. It's about changing routine. It's about identifying what you're doing well, what you can improve on. And there are 3 phases to prevent that typical yo-yo effect that we see with weight loss. So the primary phase being what we would normally think of as a diet, which is the loss phase, where again, we're using this real food re-education to evaluate that, to bring that weight down. Once we have patients at their goal weight, we put them on transition phase where we're adding calories back into their diet, looking at it from a well-balanced diet perspective. And then we have them do sustain phase where they check in throughout the next year to just make sure that weight doesn't creep back on. That's the education component. My role is a Lean MD mentor, is to work one-on-one with patients. So you get that role. I think of Lean MD as a skeleton for the proper way of eating, but we still need to individualize it for each patient and their desires and needs and other issues that they may be faced with.
Yeah, I think the key thing what Alex is talking about and mentioned is that it's real food. This is not a gimmick. There's no magic bullet. There's no magic pill that you take and lose weight. I mean, patients have to be engaged. They have to be interested in wanting to change. But it's really about re-educating yourself on portion sizes, on composition of foods, and such in order to take control of that piece of your life in order to get your health better, reduce your risk for other diseases that are associated with obesity, and move on from there.
So two final things to highlight. We are on social media. So if you follow us at LeanMD at Sierra Pacific Orthopedics on both Instagram and Facebook, that's the first start. But you can also call us at 256-5312, that's 559, and at least get all of your questions answered so you can get all the information you need to make the best choice for you.
Great, thank you so much. And people can self-refer or they can have their physician refer to Sierra Pacific Orthopedics. The program is called the LeanMD, medically supervised weight loss program offered by Sierra Pacific Orthopedics. And we will actually put the links for the website, which is very informative, in the chat box so that people can get more information. I really hope that more people find out about this vital program. You're absolutely right. This is a concern for many in the community, and it's a concern for the healthcare system as well. I mean, this is really one of those things that whenever we talk about underlying risk factors, not only for COVID, but for so many other illnesses and diseases, and just for people's well-being and happiness, this actually comes up as a huge factor, is helping people manage their weight and feeling good about their journey whenever they're doing it so that they can keep it sustainably off. So thank you so much for really, again, envisioning a need in the community and then fulfilling that need and going kind of outside of the lane of orthopedics, but something that is still truly important to keep people as healthy and as athletic as possible. So I just want to say thank you so much, Dr. Schultz, and thank you to Alex for really championing this very important issue that affects so many people here in Fresno County. And I hope that more and more people can find out about this wonderful program.
So, Dr. Brad, thank you.
Are there any questions from our media partners about this program or anything else that that these ladies can address? I'll ask a quick question. I know that Alex is a specialist in kinesiology. Can you just in a nutshell describe what that is? Many people don't understand what that is, and we know that Fresno State actually has a wonderful kinesiology program. So just for young people that are looking for career options in healthcare, can you just give a little, just a nutshell of what kinesiologists do?
Sure. So kinesiology is kind of a big umbrella for lots of things like exercise phys, for example. So specifically what's happening with your body from a ramp up stage all the way to recovery from a physical component, whether that's an athlete or a general person in the community, as well as some of the psychological components to exercise and activity. There's also an education component to kinesiology. How do we teach people from physical education from youth all the way up through college? So like I said, big umbrella, but think of activity, think of movement, think of education as kind of that general cue words, if you will, big words, if you will, for options for people to help their community out and be as healthy as it can be.
Interestingly, Dr. Bora, you may not know this, but I got my bachelor's in kinesiology at UCLA.
That's fantastic.
So you can become an
great. So you're both,
Or that.
both kinesiology experts.
That's
great. So definitely a lot of options for young people to think about, and hopefully we can keep promoting this great message about health and wellness through the many things that you do. So thank you so much once again taking time out of your busy day and joining us here on our media session to help talk about LeanMD. It's a medically supervised weight loss program offered by Sierra Pacific Orthopedics. Find out about it on wherever you get your social media, Instagram, Facebook, and then also on the website that Sonia was able to share in the chat box. So thank you so much, Alex and Dr. Schultz.
Thanks.
Take care. Great. And we'll just keep going to see if there's any other questions. I know Rich just shared a kind of a breaking announcement. I haven't had time to process it myself, but it's something about the CDC making a pretty broad announcement related to masking. And this actually is part of a larger conversation that we are having at public health at the local level, at the state level with our partners at the California Department of Public Health, and really with almost every single industry and sector. Schools want to know, when is masking required? When can we get the masks off? Obviously, employers and employees want to know. Different social activities and businesses want to know. So I totally understand there's a lot of questions related to masking. And here's what I think is the bottom line right now, is that this is changing. This is actually going to be related to how fast we can get our population vaccinated. It really turns out that once people are vaccinated, they're at much lower risk of contracting coronavirus and passing it on. And that really changes the equation of how important masking becomes. So masking was really, really, really important whenever we didn't have the vaccine. And now that more and more people are getting vaccinated, the masking is becoming less and less of a significant layer of protection that we need to rely on. And so it really is just about rebalancing some of these mitigation strategies. From everything that I've read and from what guidances I've seen, I can confidently say that, you could pretty much just go without a mask when you're outdoors if you're able to do social distancing. And most of us can, especially we're blessed with so much open space here in the Central Valley that whenever you're out with friends, family, or coworkers in the outdoors, you can really just go without masking. There's enough air ventilation, there's really enough air circulation that it's very, very extraordinarily rare to pass on COVID or catch COVID when you're outdoors. And as you can see, we're in an outdoors environment in this tent that's very well ventilated, and we're not wearing masks, and that's totally fine. So that's basically what we've been able to see from some of our state and national agencies being announced. Whenever people are indoors, then the risk is a little bit higher because the ventilation is just not optimal. But provided that you have a mask on and provided that you're doing social distancing, provided that you're vaccinated and provided that you're doing some amount of social distancing, then it's possible to go without a mask whenever you have that situation going on as well. Now, that's not to say that COVID is over. Like I said, it's not over. We can still catch COVID. In fact, every day we tell you about dozens of people that caught COVID, and the most common way that they're catching COVID is by spending time indoors with other people who didn't get the vaccine and who have COVID themselves. They may be symptomatic, they may not be symptomatic, but it's still circulating, folks. And whenever you look at other countries that are having nightmare scenarios, you see just how bad it can get. So we're hoping that we can vaccinate everyone as fast as possible to really protect the most number of people. And then we can actually really make some very definitive statements about where masking can and can't be done. For now, it really does depend on everyone getting vaccinated. And that's really what we have to look at, is to say the masking is really just on, in this larger equation with the number of community infections that we're picking up, as well as the amount of community vaccination we're able to achieve. But we're definitely going in the right direction, and we really just need to keep pushing forward. I'm sure that California Department of Public Health will respond to the CDC announcement and have their own take on where masking is still required or strongly recommended. I know that the governor's office has kind of weighed in several times this week about masking. So it is a moving target, as it were. The other big piece of this that we are actually waiting for is for California OSHA, Cal OSHA, to weigh in about what is actually required in workplaces. And they are actually meeting later this month and basically going to update what's known as the Emergency Temporary Standards, or the ETS. They've actually drafted some changes, and they really have to do with exactly what we're talking about is, how can we still protect workers, but also be sensitive to the fact that workers that are vaccinated may not need to be masked anymore. And we're really waiting for Cal OSHA to weigh in with a final draft of their Emergency Temporary Standards update. The last time that they worked on this was November, and so much has changed since November that we're really looking for kind of a dramatic refresh on all of those policies. Which we will have to work through and share with local employers and other business sectors that we work with. So we understand the concern and we welcome the dialogue. We know that there's a lot of different opinions about masking. I really just have to say we need to focus on what's scientifically accurate. and not just what popular opinion might want us to do. And we really have to follow the evidence. And if the evidence suggests that it's safe to take off masks, which at this point it really does with the outdoors, then we will follow the evidence. And that's really been our bedrock principle for public health throughout this pandemic. And that's exactly the principle that's going to guide us about whatever masking policies end up being clarified and coalesce in the weeks to come. In the meantime, please stay safe. Just know, I wouldn't just throw away the masks. Try to have some spares just in case you get into a crowded situation. You have to run into a store, for example, with a lot of other people, and the store happens to require it just because that's still the state mandate at this point. Then definitely don't leave home without a mask, but you can look forward to more and more activities where you don't necessarily have to wear a mask. And if you can at all spend time outdoors while it's still a little bit cool in the shade, then definitely you can definitely go without a mask during those circumstances.
Dr. Vora, it's Jocelyn.
Let me pause there and see if there's any other comments or questions.
Can you hear me, Dr. Vora? It's Jocelyn.
Oh yeah, sorry about that. Okay, I had my audio turned down, so go ahead and repeat your question.
Can you hear me now, Dr. Vora? It's Jocelyn.
Yes, I can. Hi,
Great.
Jocelyn.
Just wanted to follow up on what you were just talking about with mask guidance. I know when we look at other parts of the state, they have a little bit of higher numbers when it comes to the percentage of people vaccinated in certain counties. Obviously, we've talked about the demand kind of falling here. Does that worry you at all when we talk about the June 15th date where the state is reopening and now mask mandates not being required for fully vaccinated people? Is there worry or concern for you for those who are not vaccinated in the county?
It is a concern. The way that we're looking at vaccination is to say the people that didn't need the sales pitch have already gotten vaccinated. The people that were driving from Southern California to find Rick and Jeremy, the people that were really the early adopters, or the people that just needed to have one conversation and then they were on board and they're going to get vaccinated. All of those people have gotten vaccinated. Now what we're working on is the folks that are going to require a little bit more time. And they're going to require multiple conversations, the old 3 cups of tea, as it were. And we're leaning into that very hard. We understand that some people just need to have a little bit more information. They need to have a little bit more time to get that informed consent to get their vaccine, or they have special, medical situations that they just want to have that conversation with their own doctor, so that their own doctor, who knows their medical history, can actually tell them which vaccine product is right for them and exactly how to schedule that. So we get it. We know that we're in a different time right now in terms of who we need to vaccinate, and we know we need to spend more time with each and every person who hasn't yet gotten their vaccine, and we're leaning into that. Joe and his team are doing phenomenal work with figuring out ways to make the barriers lower and lower for people that are at that stage. So I think that's where we are. Honestly, looking at other counties, some counties are doing a little bit better. Some counties are doing about the same as Fresno. And so everyone's in a little bit different position. But the state is really trying to coordinate this as best as they can. They had a really productive call earlier this week with all of the counties, and they really just wanted best practices. And so we learned and shared our best practices with what worked in our vaccine education and rollout campaign. And we heard from other counties, some big counties like Los Angeles, some smaller counties like San Bernardino and San Joaquin, for example. But really all of the counties are trying to teach each other, and we're really just trying to come up with best practices to say, what do we need to do to get people, I hate to sound like a used car salesman, but what do we need to do to get you to sign the consent form and get your vaccine done? But that's basically what we're, where we are right now. We know that for some people, it's going to require 3, 4, 5 conversations, and that's totally fine. We want people to take their time, but don't hurry too much because, we're all ready to get to the next phase of the pandemic, and that's going to really depend on all of us getting vaccinated. I don't know if Joe is still on, but he certainly has a little bit more on the ground insight with really so many of the innovations that we're trying to implement as fast as we can, whether that's going out to the Grizzlies game, going out to the zoo, really working with our community-based organizations, trying to work with our supermarkets, and really just trying to get as many people vaccinated where they feel comfortable. We need to meet them where they are. And that's why mass vaccination sites like SPOC are kind of winding down, while more individualized vaccination campaigns are going to keep ramping up, because that's kind of that's the period that we're in right now.
Dr. Vora, another quick question. Just with the different news coming out in the last couple of days today with the mask mandates being lifted, it feels like we're moving in the right direction. And so I wanted to get your take on that just here locally, because I mean, we're still seeing the cases of variants going up in the county. So what is the current situation here in Fresno County? Are we moving in the right direction? Do we still have to keep our guards up? It seems with the mask requirements for fully vaccinated people being lifted, it feels like we are moving in the right direction.
Thanks for asking, Jocelyn. I would say yes, we are moving in the right direction. The speed of that movement really depends on how fast we can convince people to get their vaccine. So in general, our county is definitely progressing, and that's wonderful. We could progress faster if we figured out ways to get people vaccinated faster. In terms of the variants, there's good news, bad news there. The good news is there's, now testing being done. So we are going to have more and more information. The other piece of good news is whenever these variants are checked against the vaccines, they're still susceptible to the vaccines that are currently available. That's really great news. They may not be as susceptible as the conventional strains, but they're still susceptible, which means that these vaccines will protect you even with these variants. Now, the other piece of bad news is, eventually someone somewhere in this planet is going to find a variant which is not susceptible for these vaccines. And that's really the reason that we care about variants at all, is because we are eventually going to come across a mutated strain of this virus that is going to outsmart our vaccines as we have currently. And we just hope that that doesn't lead to a disaster or a massive, a wave of the pandemic, as it were. We hope that it won't. We really hope that we can delay that time point as soon as possible. But it is something that we need to be mindful of, is that viruses mutate. Eventually, the virus is going to mutate in a way that will no longer be susceptible to these vaccines. And then we will have to control the outbreak as best as we can using our conventional methods of contact tracing, quarantine, isolation, but at the same time, work very rapidly to come up with perhaps a different type of vaccine, whether that's a booster or an update to this version of the vaccine. We're not really sure exactly what that picture will look like, but that's basically the bad news that we have to deal with, is that these variants may kind of prolong our work as a healthcare community worldwide on this pandemic. Wow, I feel like a news anchor because Rick Lembo just printed out the CDC announcement and sent it to me, and now I could say this just in from the CDC. I won't do that, but basically it's on the CDC website right now. What I'm going to do with this is take time to read it after our media session, really discuss with our team what this means, and really just have that conversation, like I said, with the California Department of Public Health, which is our state partner, and that's really the legally binding body. So whenever the CDPH puts out their statement, that is the legal mandate that the state has to follow. The CDC does make these recommendations, and obviously they carry a lot of weight, and it's really wonderful that anyone can go to their website and understand not only what the bottom line is, but also the evidence base behind that bottom line, so that we can also just study the facts that allowed them to come to this conclusion. All of that is available to you on the CDC website. It says interim public health recommendations for fully vaccinated people. And basically, we will digest this information, talk with the CDPH, and probably have more updates related to masking come next week. So thank you, Rick. All right. Are there any other questions or any other comments or feedback? This has been such a wonderful session. I really just want to once again thank Jeremy and Rick and Dr. Schultz and Alex and really the whole team at Sierra Pacific Orthopedics. They've been such great partners for us. And I just, from the bottom of my heart, want to say thank you on behalf of public health, and thank you on behalf of a very grateful community for your many years of service and your many months of service towards the cause of the pandemic response. We look forward to collaborating further, but it's really wonderful that you are such an institution here in Fresno County. And with that, I think we'll go ahead and sign off. I hope everybody has a chance to enjoy this beautiful weather that we're experiencing. Get some time this weekend to work on your kinesiology and your calisthenics. Get your stretching done. Get some cardiovascular exercise. Find the Lean MD program if you feel like you need it, or talk to your doctor about how you can get involved. And always call mom and dad and tell them that you love them. Thank you so much. Have a great rest of your week and a great weekend. Thank you.